High blood pressure is a silent condition that doesn't shout for attention, yet it quietly shapes how the heart and arteries age over time. The real challenge is not just bringing the numbers down quickly, but keeping them stable, steady, and predictable every hour of the day. Doctors often talk about smooth control, the gentle, consistent curve where blood pressure stays within a healthy range without large spikes or sudden drops. It's what makes treatment sustainable and protects organs in the long run. Among the many medicines used to manage hypertension, two names often come up together: Lisinopril and Amlodipine. Both are widely prescribed, both effective, but they take completely different routes to reach the same goal. Understanding how they work, and how they differ, is the key to choosing what's best for long-term smoothness. And that's exactly what we do here on Pillswick. We take complex medical stories and turn them into clear, real-world explanations. No confusion, no heavy jargon, just the truth about how your medicines really work inside your body. So today, let's understand how Lisinopril and Amlodipine help manage blood pressure and which one truly delivers smoother, steadier control. Lisinopril belongs to a group of medicines called ACE inhibitors. It works by blocking a natural chemical in the body known as angiotensin II. This chemical normally tightens blood vessels and raises pressure. When lisinopril blocks its formation, the vessels relax, the pressure drops, and the heart pumps against less resistance. It also helps reduce salt and water retention by lowering the effect of a hormone called aldosterone. The result is a calmer, steadier cardiovascular system with improved blood flow and less strain on vital organs. Over time, this approach doesn't just lower readings, it can actually protect the heart and kidneys from progressive damage, especially in people with diabetes or early kidney disease. Amlodipine takes a completely different path. It's a calcium channel blocker, part of a class that relaxes blood vessel walls by limiting how calcium moves into the smooth muscle cells that line them. When calcium is blocked, the muscles relax, the arteries widen, and blood pressure falls. The magic of amlodipine lies in how slowly and steadily it works. It doesn't cause a sudden drop in blood pressure, instead, it spreads its effect across many hours. With a very long half-life, often more than a day, it keeps working even if you forget a dose by a few hours. This is why amlodipine is famous for producing a smooth 24-hour control pattern, especially when taken once a day in the morning. If you think about blood pressure control like balancing a seesaw, lisinopril and amlodipine offer different kinds of stability. Lisinopril stabilizes the hormonal and chemical systems that push blood pressure upward, while amlodipine stabilizes the physical resistance of the arteries that carry blood. The two mechanisms often complement each other beautifully. One targets the root signals that cause tightening, the other targets the tightening itself. That's why doctors so often prescribe them together. The combination gives not just lower numbers but smoother control throughout the day and night. When patients first start lisinopril, the effect may begin within hours, but it usually takes a week or two for full benefit. That's because the body's renin-angiotensin system needs time to reset. As this system rebalances, arteries become more responsive, and the daily fluctuations in blood pressure start to settle. Most people take lisinopril once daily, usually in the morning. But some find that their morning numbers remain a bit high while evening readings look lower. In such cases, doctors sometimes shift the dose to evening time or add a long-acting partner like amlodipine to smooth the entire 24-hour curve. Amlodipine, by contrast, builds up gradually. Its effect peaks slowly and stays for more than a full day, meaning that even if someone forgets the pill by a few hours, blood pressure rarely rebounds suddenly. It's the definition of smooth pharmacology. In the real world, blood pressure doesn't stay constant from morning to night. It rises early in the morning when hormones like cortisol wake the body up, peaks in the afternoon, and then falls while we sleep. For many people, that early morning rise, the so-called morning surge, can be risky. Strokes and heart attacks are more common in those early hours, partly because of it. That's why a medicine's ability to cover the full 24-hour cycle matters more than its immediate potency. Amlodipine is particularly effective at flattening this morning surge. Its long duration keeps blood vessels relaxed through the night and into the next day. Lisinopril can also help by calming the body's hormonal drivers, but in some individuals, the effect wanes slightly overnight. Adjusting dose timing or pairing with a calcium channel blocker usually solves that gap. Different people respond differently based on genetics, age, and even race. Studies have shown that people of African or Asian ancestry, and many older adults, tend to have lower renin activity. In such cases, calcium channel blockers like amlodipine often outperform ACE inhibitors when used alone. On the other hand, in people whose hypertension is driven by overactive renin-angiotensin systems like those with heart failure, diabetes, or kidney disease, lisinopril provides deeper protection. It's not just about pressure numbers, it's about organ protection. Lisinopril helps slow kidney damage in diabetics, prevents heart remodeling after a heart ATT. Every medicine has trade-offs. Lisinopril's most known issue is the dry cough it can cause in some people. It's not dangerous, but it can be annoying enough to make someone quit taking it. The cough happens because the same enzyme lisinopril blocks ACE also breaks down a compound called bradykinin, and when bradykinin builds up, it irritates the airway. Other side effects include slightly raised potassium, mild kidney function changes, and, very rarely, angioedema, a sudden swelling of the face, lips, or tongue that can be serious. Fortunately, that reaction is extremely uncommon. Amlodipine's signature side effect is different: swelling of the ankles or feet, called peripheral edema. This happens because the drug relaxes small arteries more than veins, allowing fluid to seep out into tissues. The good news is that when amlodipine and lisinopril are used together, these side effects tend to balance each other out. The ACE inhibitor reduces the swelling caused by the calcium blocker, and the calcium blocker's smooth action complements the ACE inhibitor's slight overnight fade. Drug interactions are also important. Lisinopril should be used cautiously with potassium supplements, salt substitutes containing potassium, or other drugs that raise potassium levels, like certain diuretics. Nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs, can interfere with kidney function when used too often alongside ACE inhibitors, especially in dehydrated people. Amlodipine is processed by the liver through a pathway called CYP3A4. Some antibiotics, such as clarithromycin, or antifungal medicines can slow down this pathway, raising amlodipine levels and causing dizziness or low blood pressure. Even some cholesterol medicines, like high-dose simvastatin, can interact and increase the risk of muscle soreness, which is why doctors often switch to a safer statin if needed. Blood pressure variability is more than just a nuisance, it's a hidden risk factor. People whose blood pressure swings widely from morning to night or from one day to another have higher rates of cardiovascular events, even if their average numbers look fine. That's why smoothness has become a new measure of success. Amlodipine's pharmacology gives it a natural advantage here. It lowers short-term variability and keeps the night-to-morning transition gentle. Lisinopril reduces variability too, but primarily by controlling the hormonal drivers rather than directly flattening the curve. The combination of the two, one working on the vessel side, the other on the chemical side, often produces the smoothest, most stable 24-hour control with fewer morning spikes and fewer side effects. In the clinic, this balance is seen daily. A patient comes in with blood pressure well controlled at night but high in the morning. Adding amlodipine or moving lisinopril to the evening often solves the problem. Another patient may have a great average reading but rising protein levels in the urine, a sign of kidney stress. In that case, lisinopril becomes essential because it reduces that kidney strain even if blood pressure looks decent on paper. Sometimes, a patient complains of ankle swelling from amlodipine at higher doses. Reducing the dose and adding lisinopril almost always relieves the swelling while keeping the numbers stable. It's all about pairing the right tools to the right physiology. Starting and adjusting these medicines requires a bit of monitoring. When someone begins lisinopril, doctors usually check kidney function and potassium after a week or two. If those numbers look stable, they can safely increase the dose as needed. Amlodipine doesn't need lab tests, but it needs observation, checking for swelling, flushing, or lightheadedness. Both drugs should be titrated slowly, because steady adjustments make for steady control. Sudden changes in dose often lead to instability or new side effects that could easily have been avoided. For most people, adherence, the habit of taking the medicine regularly, is what separates success from failure. Amlodipine helps here because its long duration forgives a few late doses, but lisinopril demands consistency and occasional lab checks. The best results always come when patients understand why they're taking something and what side effects to expect. Knowing that a cough might appear or that ankle swelling can be managed helps them stay on treatment instead of stopping suddenly. Good communication makes smoother curves. Special situations also matter. In chronic kidney disease with protein leakage, ACE inhibitors like lisinopril are often the first choice because they directly slow kidney damage. Once blood pressure needs further control, a calcium channel blocker can be added. During pregnancy, however, lisinopril is not safe. It can harm the developing baby and must be stopped immediately if pregnancy occurs. Amlodipine, while sometimes used under supervision, is not the first choice either. Medicines like labetalol and nifedipine extended release are preferred. In older adults, starting low and going slow is the universal rule. Amlodipine's gentle onset helps prevent dizziness, while lisinopril needs careful kidney monitoring as the body adjusts. There are some warning signs every patient should know. For lisinopril, any swelling of the face, lips, or tongue is an emergency. This is angioedema and needs immediate medical attention. Severe dizziness, fainting, or sudden rise in creatinine are also reasons to contact a doctor. For amlodipine, if swelling becomes significant, or if there's noticeable fatigue or palpitations, dosage adjustments or switching to combination therapy can fix the issue. Side effects are not failures, they are signals to fine-tune the plan. Looking beyond blood pressure numbers, lisinopril offers protection where it truly counts. It improves survival in heart failure, prevents heart muscle remodeling after a heart attack, and slows kidney decline in diabetes. Amlodipine doesn't act directly on these organs but ensures steady perfusion by keeping blood vessels relaxed all day. That steady profile lowers the risk of stroke and promotes long-term adherence, which indirectly improves outcomes too. The beauty of combination therapy lies in the harmony. Lisinopril guards the organs, amlodipine guards the curve, and together they achieve what neither could fully do alone. In practice, doctors see many patterns. A patient with high morning readings and a history of stroke often benefits from amlodipine's smooth 24-hour action. Another with diabetes and kidney changes starts with lisinopril and adds amlodipine later for additional control. Someone experiencing leg swelling on amlodipine alone finds relief after adding a low dose of lisinopril. The logic is simple: instead of maxing out one medicine and increasing side effects, combining two with complementary actions produces better balance. Hypertension is rarely a single mechanism problem. It's usually a mix of vascular stiffness, hormonal overdrive, and lifestyle factors, so multi-mechanism treatment makes sense. Lifestyle changes play a huge role in how smooth that blood pressure curve looks day to day. High salt intake is one of the biggest drivers of variability. Reducing sodium flattens the peaks and helps medicines work more evenly. Cooking at home, reading food labels, and limiting processed foods can make a measurable difference. Regular physical activity, like brisk walking, improves vessel flexibility, while good sleep and stress management reduce morning surges. Even moderate weight loss can enhance how smoothly medicines perform. Monitoring blood pressure at home helps spot patterns early. The ideal method is to use a validated upper arm cuff. Sit quietly for 5 minutes before measuring, keep your feet flat, and support your arm at heart level. Take 2 readings, 1 minute apart, both morning and evening, and average them. The trend tells a story. If mornings are higher than evenings, timing or combination might need adjustment. Sharing these readings with a doctor leads to personalized, more effective plans. Sometimes, patients assume that once numbers look good, they can stop medicine. But hypertension isn't cured, it's controlled. Stopping suddenly can cause rebound pressure rises, especially with long-standing disease. Smooth control depends on consistency, and consistency is the quiet hero of cardiovascular protection. Whether you're taking lisinopril, amlodipine, or both, regular use matters more than occasional perfection. For people juggling busy lives, amlodipine's forgiving nature is helpful. It allows flexibility without large fluctuations. Lisinopril demands a bit more diligence but gives back long-term benefits that go beyond pressure numbers. Both are safe and proven when used correctly. The art lies in choosing or combining them based on each individual's biology and needs. If you look closely, smooth blood pressure control is not just a number on a screen. It's how the body feels: fewer headaches, steadier energy, less fatigue, and more predictable mornings. It's the quiet stability that lets the heart, brain, and kidneys function without constant stress. Amlodipine provides the smooth ride, lisinopril strengthens the foundation, and together they create the balance that defines successful hypertension management. When you next meet your doctor, the best approach is open communication. Mention if you notice swelling, cough, or morning surges. Ask if timing changes or combinations might help. Small tweaks often make a big difference. And remember, self-monitoring, smart habits, and adherence make every medicine work better. In the end, if your goal is a calm, round-the-clock blood pressure profile with minimal ups and downs, amlodipine often leads in smoothness. If your goal includes protecting the heart and kidneys from long-term harm, lisinopril becomes essential. For most people, the most effective and balanced path is not choosing one over the other but combining their strengths under a doctor's guidance. Smooth control is not about chasing perfect numbers but about achieving stability that lasts for years. This is the story of two trusted medicines that often work better together than apart. Each plays a unique role in helping millions live healthier, longer lives with quieter, steadier hearts. Consistency, awareness, and regular follow-up complete the equation. And that is what truly defines smooth blood pressure control. You've been listening to Pillswick, where we simplify the science behind your daily medicines. If you found this helpful, don't forget to like, share, and subscribe. It helps us bring more clear and reliable health stories straight to you. Stay informed, stay steady, and take care of your heart.